Hi, my name is Suman Chaudhary, and my health education project is on chronic disease prevention for undergraduates at Rutgers. So, the community that is being evaluated is at risk undergraduate college students ages 18 to 24 at Rutgers. And three highlights about my community is that in New Brunswick, the population is 55,998. The median household income in New Brunswick is about 43,930. And the Rutgers, New Brunswick population is at about 50,411 students in total. So I believe that my intervention will most definitely show cultural humility, which can be described as ongoing self-exploration and self-critique. The most important and key factors that allow communicable disease prevention is to allow yourself to learn from others, such as healthcare providers, to better your own health, which is why my intervention of increasing awareness about chronic disease would show cultural humility. So, three highlights of my environment. So, New Brunswick is often referred to as an urban and suburban mix. New Brunswick is a medium sized city that is only about 5.75 square miles, and about 80% of people rent in the town, and only 20% of people own their own properties. And then New Brunswick has two major hospitals within the area, which are Robert Wood Johnson University Hospital and St. Peter's University Hospital. And these two hospitals have many other very big departments underneath their chains. So, three highlights of my issue. So, chronic disease is a very important issue, and it encompasses numerous types of non-communicable diseases such as diabetes, heart disease, COPD, and many more. So, some highlights of the issue would be that chronic disease, especially heart disease and cancer, are the leading causes of death in the United States. Chronic diseases are largely preventable with the proper nutrition, healthy lifestyle habits, and physical activity. And lastly, chronic disease is causing the nation about $4.1 trillion annually. So three ways my intervention would benefit the community. So, the main part of my intervention would be to require all Rutgers students to submit a document that would be filled out by the student's primary care physician, which would state that the student has gotten their yearly physical within the past year. So one benefit of ensuring that the students have gotten their yearly physicals and routine blood work would ensure that students are up to date with their vaccinations and their immunizations. Second off, another benefit of this intervention would mean that future generations, or this specific generation of college students, would create a habit of going to the doctor's office yearly to get their physicals and yearly checkups done. And lastly, this would also ensure that the younger generations can be educated about chronic disease and be made aware, especially if they're at early risk for any of these diseases. So how would I market this intervention to gain and retain participants? To gain and retain participants, Rutgers can simply make this a mandatory submission before students can register for classes every new school year in the September. So all students at Rutgers would have to be required to submit this form. And since all students at Rutgers are required to also have healthcare insurance, that means that all students would technically be able to get this done, especially if it was required by the school. And an appropriate evaluation of my intervention to see how successful it would be to collect data and see how many students were able to get in their physical forms and have the paperwork written out stating that they had gotten their physical done within the past year. And then, so we've noticed that my intervention would be very effective because many different universities around the world also have made getting their physicals done as a requirement before beginning school. And we've also seen that majority of schools with sports teams are required to have their students complete physicals or a physical form before joining the university each fall. And then some of the top researchers for my health issues. So one of the top researchers would be Dr. Albert Huang, who works out of the University of Chicago and is the founding director of the Center for Chronic Disease Research and Policy. Dr. Huang works as a general internist, and he studies clinical and healthcare policy issues to prevent chronic disease. Another top researcher for chronic disease epidemiology is Dr. Judith Lichtman, who works as the department chair at the Yale School of Public Health. And lastly would be Dr. Brian Schwartz, who's another very important researcher who works at a Johns Hopkins University hospital, researching the epidemiology behind chronic disease as well as the cardiovascular system. So an appropriate upstream for this health issue would be to continue to promote chronic disease prevention, which includes healthy eating, exercise, getting routine checkups, and this would all help ensure that future generations can lower the rates of communicable diseases. And if there's one thing that I would have done differently within my project and presentation, would definitely be to include exercise more in my intervention plan as well. Chronic diseases can best be prevented by getting routine checkups, which was involved in my intervention, eating healthy and exercising. And I focused most of my paper on eating healthy and getting routine checkups, but I thought that promoting exercise would be something else that I could have done differently and added to show the benefits of that as well.